Hi, thanks for joining this workshop for the Major Trauma Priority Setting Partnership, or PSP. I'm CBretherton, a clinical lecturer and trauma surgery registrar and the PSP lead. And I'm going to give you some background to the project and tell you what we've done so far. In a different video, our JLA advisor, Mary Rose, will tell you what you need to do to prepare for the workshop. And so we're representing AO UK, which is an organisation that promotes research and care for patients with major trauma and serious injuries. Most of you will know that these injuries can be life-changing and have long and challenging recoveries. And so research is needed to work out how best to support patients. And so why the JLA, the James Lind Alliance? That's because the JLA is an independent organisation and they're committed to the principles of inclusion, of voice and transparency. And this means that charity and NHS money is not simply funding the priorities of one or two surgeons or professors, but these priorities are reflective of a full range of people affected by major trauma and those that care for them. So the first thing we did is set up a steering group. The first met in December 2021. It included patients with experience of major trauma, as well as healthcare professionals, including those from ambulance teams, surgery, therapy teams, and psychology. And this is an international priority setting partnership because major trauma, as you know, affects people all across the world, and it's hoped that future studies will involve patients from across the globe. Then what we did is we defined the scope of the PSP. We did this partly by looking at previous similar projects and making sure there wasn't too much overlap, but we also looked at NICE, the National Institute for Health and Care Excellence, that has some guidance and definitions of major trauma. And so this is the scope. We have care really related to from the point of injury to the point that patients are discharged from the acute hospital. And these are the sorts of injuries we're talking about. Often they're a result of severe injuries like car accidents or falls from a large height, but they can also include more simpler injuries, such as patients falling down stairs, particularly if those patients are older and more likely to sustain injuries. So this project involves both questions related to the surgical and non-surgical care, both their physical and mental rehabilitation, as well as potentially some service design and delivery. There are some exclusions. So we've excluded patients with isolated spinal cord or isolated head injuries, post-hospital care, PTSD, safeguarding, treatments unique to military or resource-limited environments. We're not looking at injury prevention or public health measures, and we're not looking at burns, hanging, or drowning. And in most cases, that's because those have all been studied as part of previous projects or ones that are ongoing or planned for the near future. So from here, we designed a survey, which we launched at the National Trauma Research and Innovation Collaborative Conference in March 2022. We asked people to tell us their priorities with free text responses, and that was open for about 6 months with adverts on social media, patient societies, and directly on wards and clinics in the hospital. So the result is that we received over 1,500 responses from 417 respondents, of which 95 were patients, 37 were carers, and over 300 were healthcare professionals. We then grouped those into similar themes to create 53 summary questions, and then we went and searched the literature to see if any of those questions had already been answered with high quality research, because we don't want to spend time and money funding research if the question has already been answered, and it turned out none of them were answered. In the next round, we then asked people to pick their top 10 priorities from those 53 summary questions, and we received 357 responses, 74 from patients, 32 from carers, and the rest from healthcare professionals. We then processed those responses, because we had more responses from healthcare professionals, but we wanted an equal voice with patients. We produced a separate top 10 ranking for patients and a top 10 for healthcare professionals. And then we combined those to give a final 19 questions that we'll be discussing at the workshop on October 17th. And so that's where we are at the minute. And there's a little map here of the sort of engagement we've had across the globe. So as I mentioned, there's a link to Mary Rose's video in the instructions if you haven't watched it already, and that explains what will be happening at the final workshop in more detail. But broadly speaking, the purpose is to decide a top 10 list of research priorities, which can give to funders and will ultimately guide future research. And what that's going to do is that it's going to ensure that we can research the most important questions that are going to make the biggest impact on the lives and recovery for patients affected by major trauma. And so lastly, I'd just like to say thanks again for participating in the workshop, and I look forward to seeing you on October 17th. Thanks.